absent. Priscilla? Here. Geraldine?
Here.
Martel?
Here.
Joanne is absent. Christine is here. We have a vacancy. Andrew, I know, is gonna be absent. And Courtney?
Here.
Okay. And I need an approval to the July 15th minutes or any corrections.
Do you have a packet?
Yeah, I do. I printed them like literally last night in the printer. I grabbed it on the way out the door. I think they're good. Yeah.
Do I have a motion to approve the minutes? Did anybody see any corrections?
I'll make a motion to approve.
I need a second.
I'll second.
All in favor?
Aye.
Moving on to the old business of the dog and cat licensing. As of now, we have 462 dog licensings and 86 cat licenses. As of our last meeting, I think we had 4 dog licenses outstanding. Have they been resolved yet?
No.
Are they still with the court? Okay. Moving on to B, retail food establishment fee schedule. And that's where we need to approve. Are we approving? This is, ordinance 256 or 2506?
2506. That got approved last meeting.
That was just the
That's for mobile food.
mobile food.
Yes,
Okay.
this is for retail food
The retail.
establishments that are brick and mortar in town.
Okay. Now, do we have that? I didn't see that in here.
Yeah, I didn't see it either.
Because it wasn't decided
It
last
wasn't
meeting.
decided.
Yeah.
Okay. So we still need to make the fee schedule is what we're working on.
Correct.
Okay.
I had notes from my notes last time. I think we had level, it was 1, 2, 3, and 4, and then we had 80, 120, 200, and 250. Right? Isn't that
That's what I tossed out to the
Yeah,
group.
that's what we left off.
Yeah.
And then we had talked about maybe adjusting that over time, going upwards from there.
Right, it was a start.
That was like a starting point to
Mhm.
start off with as a springboard, and then over the years, we can adjust that as needed. Because there was just too much of going for, there was one of the places that was a small fee, and they were a group 4,
Mhm.
and they were gonna be an astronomical fee, and I think we thought that that was just too much.
And did we discuss, that Randolph has a surcharge of 5 cents for additional square feet? Were we gonna add that on to these, or was that in the sidebar discussion? Sorry,
I think that came up in discussion, but
I think it was too hard to,
I think
not administer, but you know what I mean, keep track of it. Do we wanna keep it simple?
probably.
I think the simpler, the better,
And I think there was discussion about
breaking out.
maybe nowhere in town even meeting what the surcharge was. I think the surcharge was 10,000 square feet and over. I'm not sure if there are places in the borough that are that big.
I think the only place would be a food store, and that was something that we were branching out into a separate
Right.
category altogether.
You're talking about like a supermarket?
The supermarkets in town,
Yeah.
that they were gonna be a different class.
Mhm.
Right, because back in June, we talked about, I think it was like, for level 1, 2, 3, and 4 was 100, 200, 300, and then 400.
400,
There was
right.
negotiation, and then there was, I think supermarkets were 450. That was the discussion back in June.
Can you read off those, fees again for 1, 2, 3, and 4 that?
I think in June, we had, level 1 was 100, 2 was 200, 3 was 300, 4 was 400.
Yeah.
4 being like the highest risk, right?
Right.
And then that was June, and we had more active discussion in July. And then in July,
You changed it to 80, I think?
yeah, I think we went to 80,
120,
120, 200, and 250, and then I think the discussion was still on the table to carve out the supermarket.
Right.
For 400 plus a percentage for square footage.
400 plus, like the 5 cents for over 10,000 square feet, right?
Right.
I think we have to start somewhere, honestly, like,
Yeah.
we gotta start somewhere.
I think that's a good starting point.
So you've got 3 places here in town that we would consider under the supermarket category. You've got Aldi, Almadina, and the Farmers Market.
Okay.
Those are the only 3, so I think,
Oh, I remember now, cause then
It's-
Aldi and then Almadina is new, right? Wasn't it?
Yes.
I remember this discussion, that there was just concern that he was a new small business and was getting like the largest fee, if I'm not mistaken, but I don't know. Did we ever talk about that? A little bit, or not, okay.
I think he had more of a higher risk.
He did,
Didn't he?
prepares food too.
Right.
And what was the third one that you mentioned?
the Farmers Market.
That's it.
And where Aldi's just does all prepackaged stuff. So they're the lower risk.
Mm.
So I think it's really up to the board at this point whether you wanna stick with just a risk category, or if you do indeed wanna break supermarkets out of that and add it as an additional category.
I don't know, my personal thing is, I think that's fair, that, you know, supermarkets are significantly larger. They have, you know, even though that, you know, Aldi's all frozen, they have a lot of, like, they have freezer space, they have walk-ins, they have, you know, like, they have a lot more, you know,
You have to make sure there's no drainage.
just a lot more to inspect. I mean, I've been in the farmer's market, that just seemed, I haven't, like, that's all produce though, pretty much, right? Did they have anything else in
They
there?
had a deli.
Yeah, they have
I
a
see
deli,
there's signs for sushi.
Sushi.
So they're gonna,
fish.
they would be, are they
Yeah, so
just
that's
fish or
make it a
sushi?
level 4 anyway.
I say they're gonna be a level 4 if they advertise
fish.
sushi.
Yeah.
I don't know if it's sushi, I think they just have fresh
Just
fish.
fish, yeah.
Okay, I thought I've seen advertised on the board sushi.
Okay.
I've never been
I
in
don't
it.
know.
But is it also prepackaged sushi? I don't know.
Yes,
Is it prepackaged sushi?
yeah,
Or
they don't
fresh?
always have it though.
Okay,
Like they don't make it from the fish counter and
okay,
they don't do that.
okay.
Probably make it in the back.
So it comes in
right?
some,
Or
some
something
get
like that,
cells
right?
packaged.
Do you know? You don't know, okay.
Well, it's raw fish anyway, it's gotta
It
be like
is,
refrigerated,
yeah.
it's gotta be dated, it's gotta be
And they have a freezer too.
packaged appropriately.
No, is it a different level risk if it's prepackaged from somewhere versus them making it? As, say if it is sushi that's there. Is there a different risk level?
I would, yeah.
Because they're not preparing it
Right, they're just responsible for keeping it at temp.
at temperature.
Yeah.
So really, and Almadina's is the one that's really the highest risk because they're the one who's doing some sort of cooking and prep work there.
Right.
And yet you're saying that they're the smallest store.
I didn't say that.
Oh, okay,
No, I did not.
They are the smallest store though, they're in the old barn,
okay.
which proves, it's not a big store.
I don't know, I think this works, I think, you know,
Yeah,
four
I
categories,
think
and
it's
then the
good.
supermarket category, and then if they're over 10,000 square feet, 5 cents a square foot is like.
Yeah, I don't think any of them are over 10,000. I'm not sure about the farmer's market, but.
Well, I think I think it's actually a reduction for some of the levels, right? From where we were.
Some of them were
Some of them were reduced.
Yeah, or what we're charging now.
Correct.
Yeah.
But then there was one that was going, the old scale was greatly increased.
I think the level 4
pulling the having the supermarket separate then?
Yeah, I think so.
Right?
Yes.
Yeah, I'm good with it.
Seems appropriate. It's not Tractor Supply, you know, they're not,
Right,
and Tractor Supply is not them. Even though they have enormous square footage, they got like a little candy section, right? And I think that's it.
Yeah, I think what we were figuring, they were paying, like Tractor Supply was paying just as much as some other places, because they were paying by square footage.
Can I ask, this is just a sidebar question, what is the dollar store considered?
Risk one,
Cause they have freezers and they sell food.
it's all prepackaged.
It's prepackaged.
That's like Aldi though.
Right.
So how come they're different than Aldi? How come they're not considered a supermarket?
They're a convenience store.
and Aldi has the freezer sections.
Cause they,
So
I know, like, as a convenience store, if they're selling, like, how do they stay, like, maybe the question is, how do they stay under a convenience category when they're doing the same thing as Aldi? The only difference is I think Aldi sells fresh meat. Cause the dollar store has dairy, has frozen food, has canned food. It has like all those things.
Well, so does Walgreens.
That's
Yeah,
true.
Walgreens
Yeah,
has that
I mean,
too.
That's true, true,
So,
yeah. It's interesting.
yeah.
Well, then the question might be, is Aldi a supermarket? Or a convenience store?
I think it's a supermarket.
Yeah, I don't think
Yeah.
we can consider
Yeah.
all the.
Yeah.
Maybe the difference is fresh fruit. I'm just looking in my head, so like, what is the difference? Maybe it's fresh fruit. That would, like, make that, differentiate that. If anybody asks, like, why is it, Makes sense. So what do we do, make a motion?
I need a motion to accept the fee schedule as separating out the supermarkets.
I'll make a motion.
I need a second.
I'll second.
All in favor?
Aye.
Okay. Any new business?
I have two things. The flu clinic in Rockaway Borough will be October 16th. We'll be at the senior meeting from 10 to 2, which is here, and then we'll be here 3 to 6 as well for residents to come and get their flu vaccine with us. We're working on flyers and advertisements, and as soon as those are finalized, we'll make sure we get them throughout town, and they'll be put on the marquee and stuff like that.
Can I ask a question, is that free, or do they get charged, or how do people? It's all free.
Mhm.
And if you have insurance, is it still free, or do they charge the insurance?
We bill insurance,
What was the date again?
October 16th.
And do they need an appointment?
No.
Okay.
I have more questions, I'm sorry, do you have the like vaccines that are for 55 and over, and then 55 and under, or it's just one?
So we have both, but it's 65 and over,
65.
64 and under.
Oh, okay.
Yeah, so 65 and above is high dose, so we do have that.
Oh, okay.
Yeah.
Alright, now I work for an organization, they recommend 55 and over, they do 60, they do that. That's why I was asking. I think 65 is appropriate, personally.
And then, the other thing that I just wanted to mention is I'm sure that you have all seen in the news that there's quite a bit of uncertainty around vaccinations in general, but particularly these new guidelines that came out about the COVID-19 vaccine and who can get it and who can't, or who may have trouble getting it, who it might not be covered by insurance, things like that, and what's considered on-label and off-label use. So a couple other states have come out with executive orders. We are waiting for the New Jersey State Health Department and the governor to make a decision about this. We've been pushing at the local level for some answers and some clarity. Unfortunately, we haven't gotten that yet. So I'm hopeful by the next meeting, we'll have some very clear guidelines about who will be able to receive that.
Will it be able to be provided to at least the individuals that are currently recommended to get it?
Yeah.
And do we have access to vaccine?
The health department does not currently, because we're waiting to be shipped the vaccine, but I know there's a lot of, hesitancy in pharmacies and pharmacists right now with, what's gonna be allowable, like are people gonna be able to self-attest that they're high risk if they're under 65? So there is vaccine out at pharmacies, but I think there's a lot of hesitation about liability and coverage that is sort of circulating from what I understand. That's all I have.
Any correspondence? And I'll open the floor to the public.
So you have anything to say? I was just gonna ask just for a clarification on the fees that you just approved. The grocery stores or the, like, Aldi or anybody with like milk and eggs, are you considering a grocery store? And are their fees being reduced from what you just changed it to? I didn't hear what the original fees were. What were the tiers originally that you're upping them? How much are you upping the fees? Can you just clarify the difference, please?
We didn't have a grocery store fee before.
Okay. I think they were originally charged by square footage. So it's hard to correlate what they were previously.
But not the 1, 2s, and 3s, right? What about the 1, 2s, and 3s? How much are they going up?
We didn't do
We
that.
actually decreased them.
You what?
They were all square footage, so the stores were based on square footage. We're changing the whole model.
So is the goal, are they getting charged more or less? Is my question.
It's hard to answer that.
Some will be charged more, some will be charged less.
So the purpose of this is to cover the fees for the inspector, but you don't know what the difference is of what you were charging them prior.
By each individual retail food establishment, no.
So you just want to streamline it? Is that what you're trying to do, I assume?
Correct.
Okay.
I would also say make it equitable, though, because if you go by square footage, some people don't sell a lot of things, a lot of product. And if they're charged by square footage, then that's a lot. Right? Am I mistaken? The example we were given, like Tractor Supply is huge, but they only have a little area where they have candy and things like that. So it was to, I think the goal was to make it equitable and then also have it rated based on risk.
Okay.
And be evaluated, they're evaluated based on this, right? Yeah, so just to make, the goal is to make it
Okay,
equitable.
thank you for the clarification.
Any other questions?
Yeah, hi, Katie Clark, 66 West Flag Street. I had a quick question about the COVID vaccines. So you mentioned that the health department doesn't have supply right now. Just with, I know, I'm hoping it's still summer, but it's not really. It's getting colder. So what would you recommend to myself or members of the public who are concerned about not being able to get the vaccine, or some of the uncertainty around that? Because I was actually expecting you to mention it, but the fact that the state's looking to make a decision and sort of increasing the access or restoring access to what it was previously, I guess what can we do?
We're hopeful that they restore access. I know in New York and Massachusetts, the governors have made executive orders to restore access, but that's even having some effects that are trickling down to the pharmacies because they're not state specific, right? CVS isn't just in the estate. So I think the challenges are being worked out as we speak. What I would recommend from the health department is to talk to your primary care provider.
Okay.
And see what they recommend. I do know that there are pharmacies that do have the vaccine, but like I mentioned, there's a lot of hesitancy about liability and coverage as well. Because if they're administering to somebody who it's not recommended for, it's considered an off-label use.
Oh,
So-
okay. Great, thank you. And that doesn't really affect anything to do with the flu vaccine? Access or anything there,
We're
availability?
ready to go with flu from the health department.
Perfect. And then just to tack onto Bonnie's question about, so you're changing the fees, I know it's a completely different model. I guess I've heard you say at previous meetings about covering the costs of inspections and the time it takes. What if, once you implement this new schedule, and yes, it's a better system, I guess, and way of evaluating according to the risk. What if it doesn't cover the fees for the inspectors? I guess, you're gonna up them? Like, how does that work?
So the idea is that the risk levels and the fees associated with them are progressive, right? They get progressively higher because it would take more time to do the
Okay.
higher risk levels. So for example, right now, one of the risk 4s, which is the highest risk level, is only paying $70.
Oh, okay.
The inspection takes far longer than $70 will cover. So the idea is that the higher the risk, the higher the fee to cover the time it takes for inspection.
Okay. Can you give me an example of a tier 4?
Like a sushi restaurant.
Okay. So tier 1 is like Tractor Supply selling candy.
Like prepackaged food, a
Okay.
convenience store. 2 is something like Taco Bell or McDonald's, ready to eat food. And then a 3 is where they're preparing and they're hot holding or cold holding for an extended period of time. Somewhere like the diner would likely be a risk 3.
Okay. Thank you. And then, sorry, you were reading all the numbers before. Can you, the ones that you revised them to in July, what they're going to be? Is it 80, 120?
200 and 250.
And then the supermarket category was going to be 4.
400.
Okay, thank you.
Any other questions from the public? Okay, then I will close to the public, and we will go over our staff reports.
Alright, so the month of July, this is the environmental report, there were 5 certificate of habitability inspections, 8 food and drink inspections, 1 visual lead inspection, 15 mobile food vendor inspections, for a total of 34 inspections in July. There were 4 environmental OPRA complaint requests completed, 1 housing complaint, and 1 summons, notice of violation or letter issued for a total of 6 complaints in July. And then in August, there were 54 certificate of habitability inspections conducted. Those were mostly the Ramada. We should be there this month to finish the rest of those inspections. 1 food and drink re-inspection for a total of 55 inspections. There were 8 environmental OPRA requests completed, 1 housing complaint for a total of 9 complaints in August. In the July nursing report, there were 2 referrals made for child health supervision. There were 5 children screened for elevated blood lead. There was 1 initial capillary positive, 1 positive venous draw, so 4 cases were closed. There were 2 telephone or follow-up calls made to the elevated venous draw case. We did a blood pressure screening at the community center, and there were 8 people screened there in July. We did 1 home visit related to blood pressure. We had 4 communicable diseases reported and 7 disease investigations completed. And then for our immunization clinic in July, we saw 1 adult and gave 1 vaccine for our 317 clinic. We saw 5 children for our VFC clinic and gave 11 immunizations. And then the nurses did attend a vaccine provider call, a regional epidemiologist call, and met with Beacon Senior Services. Then in August, there were 3 children referred for child health supervision. There were 3 children screened for lead, 2 were capillary positive, 1 was a positive venous draw, so 2 were closed. There were 3 telephone call follow-ups related to the positive. The nurses consulted with Lincoln Elementary, TJ Middle School, and Morris Hills High School about immunization guidance. We do always get a lot of back-to-school calls about whether kids are gonna be able, based on their records, if their audit's gonna go okay. We also like to coordinate with the nurses in advance to try to get anybody into our vaccine clinics that may need to catch up before on their vaccine schedule. There were 2 people screened for blood pressure. There were 2 communicable disease cases reported. 1 hepatitis letter went out and the case was closed. 1 Lyme disease case as well. There were 5 adults who attended the 317 clinic and 15 immunizations were given. And our VFC clinic, 14 children were served and 26 immunizations were given. And then again, the nurses did attend the NJDOH vaccine provider call, a VaxCare call, and the regional epidemiologist meeting.
Busy. Any questions on the staff reports?
I have a question. So, it says that, were we still tracking COVID cases? Are they still tracking COVID cases?
The ones that come in through communicable disease reporting
Communicable
system,
disease.
yeah. So they're being tracked, but they are not being investigated.
Right, just like it's kind of going on.
Any other questions? Any vouchers? Any other questions in general? That was a quick meeting. I'll take a motion for an adjournment.
I'll make a